Hello and welcome to the podcast from this Health Pines Institute for Sports Medicine and Human Performance. I'm your host, Tim Lightfoot, and I'm so thankful that you were able to take the time to download us and watch us. As regular watchers know, we work every week to bring someone, an interesting person from the world of sports medicine and human performance to us. And given what's going on with the pandemic right now, we've been focusing quite a bit on that in the last few weeks. As a reminder, we'll remind everyone that if you go right here to the website that's listed right here, this is where you can find the current guidelines from the American College of Sports Medicine regarding exercise during the pandemic. That's available there. We really encourage you to check that out. And I bring that up in particular right now because we are so excited to have the person who wrote those guidelines for the American College of Sports Medicine with us today, Dr. Liz Joy. Welcome to the podcast today, Liz.
Yeah, thanks so much for having me.
Oh, we're so glad to have you. I'm going to tell the audience a little bit about you, and then we'll just jump into our conversation. Dr. Joy is a physician. She's currently the Senior Medical Director for Wellness and Nutrition in the Office of Health Promotion and Wellness in Intermountain Healthcare. She's based in Salt Lake City, Utah. Dr. Joy is a past president of the American College of Sports Medicine, and she's had several leadership positions in the organizations over the years. As I suggested earlier, she wrote the current ACSM guidelines about exercising during the pandemic. Dr. Joy received her medical degree from the University of Minnesota. She has certifications in family medicine and sports medicine. And again, we're so glad that you're with us today on the podcast, Liz. And let's just start out with I think a pretty general question, and that is it safe to exercise during the pandemic?
Oh, it's absolutely. Not only is it safe, but it's really necessary.
Mm.
I mean, physical activity and exercise is really how people, improve their health, manage chronic disease, but I think more importantly, kind of deal with stress.
Mm.
And this is a stressful time. I mean, people are really concerned about their own health, the health of their loved ones. And I know for me personally, what got me out of bed at 5:30 this morning to ride my exercise bike was that I knew I was going to have kind of a busy day. Yeah. And, exercise is really how I cope.
Yeah. And we focus so much on the podcast about the physical and the physiological aspects of this. But one thing we really haven't talked much about is the mental side of this. And certainly exercise helps with that.
Well, there's, several studies, and the body of literature is expanding in this particular area, looking at the relationship between physical activity, physical fitness, and mental health. Mm. And there are studies that show that, people who are more physically active are less likely to have mood disturbance like depression and anxiety. There's also studies that show that, moderate to vigorous intensity physical activity can actually be a substitute for medications used to treat depression and anxiety. So, exercise is truly medicine.
So it certainly works that way. And so in this case, we were privileged to have Dr. Dave Neiman on the podcast with us a few days ago, and he talked a lot about the research behind how we know that exercise actually can support immune function, especially moderate exercise. When you're dealing with patients and as you wrote the guidelines, it was very interesting that you talked about if you're asymptomatic, don't necessarily do vigorous exercise. I think that's a warning we need to continue to tell people.
Well, I think we know that, high volume, high intensity exercise, is in fact associated with a decline in immune function. Mm. And right now, we're dealing with a novel coronavirus that has a high degree of transmission, meaning, one person to more than one, as well as higher degrees of infectiveness, meaning that if you're exposed to it, you'll actually get infected. And then it also has, it at least appears to have more severity once you're infected, particularly if you're older or you have underlying disease processes. So if you happen to be, a 65-year-old guy, who had diabetes and high blood pressure, and we're thinking this is the year I'm going to train for a marathon, you might make different choices.
Yeah, let's put that off a couple of weeks, right?
Absolutely. Well, we say none is bad, some is good, more is better, when it comes to physical activity. but I think that we ought to kind of stick with the some is good right now.
And that's a good place to be at this point. Some is good. So you're in the clinic a couple times a week. What has been the general response to people when you've talked to them about the benefits of exercise? Have they been accepting or leery or?
Oh my gosh, that's such a great question, because I shared this with some colleagues actually earlier this week that, when I'm talking to people, whether it's a telephone visit or a virtual visit, and I've done some face-to-face visits as well, although we are discouraging people who are otherwise well to come into the healthcare system. And when I talk to them about how are you taking care of yourself, during the pandemic, particularly if you're kind of isolated at home, let's talk about what you're doing for physical activity. How are you maintaining healthy eating? Are you getting restorative sleep? And how are you managing stress? How are you connecting with other people in your life if you need to stay at a minimum 6 feet apart? People are so grateful. I mean, the gratitude that comes from actually taking the time to talk about that, it's been remarkable. So, nobody is saying, I don't want to talk about that, or that's not important. I should be talking about, washing my hands, or I don't know, something else related, directly to COVID-19. No, just the opposite. Lots of gratitude, lots of interest. We're forwarding some fact sheets, that we've created through the healthcare system, to address things like physical activity, including the Exercise is Medicine handout, healthy and safe eating, mindfulness-based stress reduction, getting restorative sleep during the pandemic. So really thinking very holistically about people's health right now.
Well, one of the nice things about the guidelines that you wrote for ACSM and through Exercise is Medicine is you talked about strength training. Just because people can't get out of their house or don't have access to gyms doesn't mean that they can't do strength training. As a matter of fact, you made some really nice recommendations about that.
Well, I think that they are the stepchild in some respect, of the physical activity guidelines for Americans. We talk about 150 minutes of moderate intensity physical activity and a lot about walking, and I'm a big fan of all of that. But we oftentimes neglect to talk to people about the importance of strength training, and yes, people think that in order to strength train, you have to go to a gym and you have to pump iron, in order to get those benefits. But we have work, by many, who have shown us that you can strength train, you can do muscle strength training without any equipment at all. And so, I specifically called out the 7-minute workout or the scientific 7-minute workout as it is often referred to, because there is an evidence base showing that it can improve fitness, and it can be done without any equipment. And, the vast majority of Americans have smartphones. Even our most vulnerable patients have smartphones. It's a free app they can download to their phone, and they can, achieve the recommendations of the physical activity guidelines for Americans of doing strength training twice a week by downloading a free app and not having a lick of equipment at home.
Yeah. And that's incredibly important for people, because that's when I've talked to a few people, they say, I can't do my strength training at home. I said, yeah, you can. Again, you download the app and you follow what it tells you, and it takes you through a nice workout that you can do inside. So I appreciate you putting that in the guidelines for folks, because oftentimes they think, oh, geez, I can't do this, so I'm not going to do it. And that's harmful to their health as well.
Yeah, I think another thing that is really important right now is that people try and get some outdoor time. Even in states where they have shelter in place regulations, and we have some counties here in Utah that have shelter in place regulations right now because of high per capita cases of COVID-19. It does not mean people cannot be outside. It doesn't mean it does mean that they shouldn't go and exercise with 10 of their closest friends, walking on the same trail. I mean, you still want to follow the CDC guidelines around maintaining appropriate physical distance, but we really do want to encourage people to get out. I mean, we don't want people to suffer from nature deficit disorder during the pandemic. And maybe that means taking your dog for a walk, or gardening. people who garden generally achieve, a moderate intensity level of exertion. If you're digging and squatting and standing and lifting plants and weeding and doing raking, getting your yard ready for the spring and summer planting. So I think there's lots of different ways to be creative and be outside and still be safe.
And I think that's the interesting thing is that it is spring now. I've heard more people now that they're going to put in some kind of vegetable garden or do something else. And I don't know if they think they're going to have to feed themselves or what, but so they're certainly getting that kind of exercise. And like you said, with most of the shelter in place restrictions, for example, we're under one here in Brazos County. One of the exceptions is you can go outside and exercise just as long as you maintain social distancing with people that you don't live with. So it's in most cases, yeah, people can go outside. I said, and maybe you've seen the same thing. I've seen more people out exercising, I think, in the week and a half that I've been at the house than I've seen ever before.
Yeah, I would agree. I went for a fantastic hike over the weekend with a friend with both of our dogs, and we both commented that likewise, we've never seen so many people. Now, of course, it made us think maybe we shouldn't be on this trail. We ought to be on a different one. So I might make a different choice because the weekends, of course, are busier. But I think it's just worth mentioning that, people can definitely and should definitely try and get some outdoor time and not be cooped up all day long sitting on their couch or at their desk or in a chair with their laptop, because, we also don't want people to be sedentary all day long, right? We know that, 30 minutes of moderate intensity physical activity, doesn't actually undo the adverse effects of 6 hours of sedentary time. So, while people are working at home or sheltering in place, get up and move around. If you have a standing desk or a treadmill desk, take advantage of that. If you're working on your computer at home, try and get up every hour and just take a lap around your house. But try and avoid prolonged sedentary time because that's not healthy either.
No, and that's what you and I were talking about before we started recording, was that it seems like during this time when we're all at home and we are all working from home, we've got more screen time than we've ever had before. So that's very important to remember is get up and walk around.
Absolutely.
Yeah. Now, one of the great things that you put in the guidelines was that this is a great time to actually reconnect with your kids and do indoor activities and sometimes outdoor activities with your kids.
Well, I did try and convince my college-age daughter to go for a hike with me the other day. She politely declined. Mom, I'm still doing online school. But no, I think, it is an opportunity. There are parents who are at home doing homeschooling of their kids because most schools are closed right now, and thinking of creative ways to engage your kids in, physical activity and playing a game or going outside and kicking a soccer ball, taking your dog for a walk, anything you can do to kind of get up and moving, play a game of Twister. Do a yoga class with your kids. I mean, there are so many videos that are available online. And I love some of the family videos that I actually, give links or URLs to my patients to say, this is something that you can actually do with your 6-year-old or your 12-year-old, and you can do it together.
That's certainly great advice. And let's make the most of the time that we've got indoors, right?
Absolutely.
Yeah. Well, Liz, thank you so much for taking the time to be with us today. Our regular listeners know that this is the time of the podcast when we always ask our guests to give us their take-home message. So if there's one thing that if people remember nothing else from this podcast that you'd like for them to remember, what would that take-home message be?
So as a sports medicine physician, I often tell my patients who have an injury that an injury is an opportunity, to work another part of your body. So if you have a shoulder injury and you really like to do upper body weight training, well, it might be time to focus on the lower body, or if you have a sprained ankle, maybe instead of running, you get on an exercise bike with your air cast. So I think in the time of this COVID-19 pandemic, it's about saying, well, I can't go to the gym, and there are some things I can't do. I'm not going to the office. So what are the things I can do? and taking advantage of doing some home workouts and figuring out what is your capacity, in terms of doing strength training without the equipment, of your local gym, and getting outdoors and doing more outdoor physical activity. Maybe you're used to running on a treadmill in the gym. Maybe try running around your neighborhood. So really think of it as an opportunity to be creative about your physical activity and exercise.
Well, that's a great take-home message, and I hope everyone takes it to heart. And thank you so much for taking time from your schedule to be with us today.
Yeah, my pleasure. Yeah, thanks for asking.
You're welcome. And thank you all for taking the time to download us and to listen today. Tune in with us again next week or even sooner, when we bring someone else to you that's interesting in the world of sports medicine and human performance. And before we go, let me remind you that if you need those guidelines on how ACSM guidelines, exercise guidelines, are right here. So go ahead and pull those up. You've met the author now, and so you can even take them more seriously than you did before. Again, we always say we want you to stay active and healthy, but again, we've been adding to that. Make sure you remember to social distance, cough into your elbow, wash your hands a lot, and be active. That will help you stay healthy. And until next time, we hope you all do stay healthy.